you. I think it's still morning, so good morning to everyone here. It's a pleasure to be in Milan. And I'm going to talk about our experience in January of this year when a team visited Namibia. It all started by the chairman, Professor Arthur, getting AI to go to Namibia. And when this system got to the airport, the immigration officer said, "Where's your passport?" AI? AI didn't have a passport. Then they called the Namibian government. "Would you allow AI to come into our country?" And the Namibian government said, "Has the system got a work permit to come?" And the answer was no. So we were running into trouble because we had promised that we were coming. And we had to call the president to say, "The AI team wants to come and treat your people, but they won't allow us in." And the president said, "Sorry, my people are not as educated as you Westerners. I know all the myths going about the vaccine and stuff like that, that they don't think they'll take AI to come and treat human beings. That the people in Namibia want human beings to come and treat them." And then we had to do everything. So I am Rotimi Jaiyesimi, a gynecologist, obstetrician and gynecologist, with an interest in medical law and global health, and a little bit about technology as well. And I'm the president of Adam Global Healthcare, relatively new, and going to Namibia was our very first venture. The picture you see here in the middle is the president of Namibia, His Excellency Edgar Geingob. To his right is our chairman, Professor Arthur, and to the right of Professor Arthur is the health minister, Kalumbi. Next slide, please. Oh, you mean the others? Next. So the decision to go to Namibia, thanks to our chairman, who has got a personal relationship with the president, and that made it easier for us. Next slide, please. And we took a team of 10 people to Namibia. I led the mission because it was clinical. The chair, Professor Tahir, was more on the strategic aspect, meeting the WHO. So I was there. Then we had a theatre nurse, Hilda, Paul Bauer, who is here today, Dr. Bauer, from anesthesia, Khan, consultant orthopedics, Eamon Kaya, who is here today as well, consultant ophthalmologist, Mrs. Adebimpe Matiluku, a consultant gynecologist, Mrs. Chin Kalumbi, a gynecologist, Mr. Jagwat Singh, who was supposed to be here but unfortunately couldn't make it, and Dr. Patrick Owubawa, a GP. So that was the team that went. And next slide, please. No health system in the world is perfect. Even in the West, we saw what COVID did. And when you are in a bubble, you always think you're doing the best things. No matter how good you are, there will always be areas for improvement. So our going to Namibia was not to tell them that their health system is poor. It was to say, where do you need help? Where can we help you? So it was more like a scoping visit to find out where the deficiencies were and where Adam Global could fit into their health system. Next slide, please. And like I said, we were welcome. Oh, it was lovely. The president had to come off his holiday on the Monday when we were going to start work to come and meet us, which was a surprise to us because we were not expecting it. Then we had met the Prime Minister, Sarah, at the IBF 2022 conference in Mauritius. She came to represent the president then. And our mission was facilitated by the High Commissioner, Her Excellency Linda Scott, the Honorable Minister for Health and his team, that is the middle senior level management, and the staff of all health facilities that we visited were welcoming. Next slide, please. That is the president. I think this was the very first time he met us here on the Monday. And he was surprised that 10 people from the UK will leave the comfort of the United Kingdom to come to their country. Surprised in a pleasant way, in a positive way. Next slide, please. Like I said, he met us on Monday, and at the end of the trip, he hosted us to what we'll call a state dinner, because all members of his cabinet were there. We were given a work permit so that we could practice on human beings. And we were also worried, what about if things go wrong and they sue us and the government again gave us professional indemnity? And our visit got prominence on national and radio coverage. And the best bit was the Namibian beef. You have to taste it. It's the best beef in the world. Next slide, please. That is a president, and yeah, Abdullah is here, yes, I can see you, and Ayman is here, and that's to the far right is Dr. Chim, the obstetrician. I don't recognize the person on the left here, on the left here. Next slide, please. And that was after we had visited the State House. That's the front of the State House. Next slide, please. That's meeting with the Health Minister. Next slide, please. So, global health disparities. There's no doubt that there is disparity in this world. And that's why we have the SDG goals, where no one is left behind. And our visit to Namibia highlighted the lack of resources, financial, human, and various other things. Namibia is a very large country. I think it's about over 400,000 square kilometers, and the population is about 2.5 million, with about 3,000 to 4,000 people living in the capital. So you can imagine what's happening in the other aspects. They have to reach area, health facilities and stuff like that. And working in a low resource country shows us that there are difficulties that one will encounter. So you've just spoken about resilience. Resilience of the staff, the local staff. Resilience of the people who need care and can't get it. Having to spend money out of your pocket to access health care. It takes its toll on the family. Next slide, please. In the previous slide, I put something there about the arthroscope. They had an equipment called an arthroscope, which they said they've had it for over 6 years and not used it. Oh, it's faulty. When our team got there was nothing wrong with it. It worked. And we used it successfully to operate on patients. And collaboration. I think one of the problems in the world, again, Dr. Cameron mentioned collaboration. One of the problems when going to other countries is to assume you're coming to teach them something. No, we went there as equal partners, a bi-directional approach. That is, we want to learn from you as well, but we want to hear what your problems are and to see how we can help you. So it was a partnership. I've been told. Awareness of the health challenges, yes. We visited health centers, the two main hospitals in Windhoek, GP practices outside of Windhoek, and we knew we had an idea of what was going on. Next slide, please. So our visit to Namibia really generated a lot of interest to the effect that more people would like to go. More clinicians have decided they would also like to go. This year we'll be sending a team of 4 in November, and hopefully next year we'll also be sending a bigger team. So the Namibian visit has encouraged individuals to examine their own roles in addressing healthcare disparities and promoting equitable access to healthcare globally. We take things for granted in the West. So we hope that your presence here today will be part of our planning. We've seen tax people, we've heard from the accountants, we've heard from AI, using AI, telemedicine, remote monitoring. This is where AI is going to come into the health space. Next slide, please. I'm not going to go through all of these because these are slides of what we did. Just, we're going to whisk through it. Primary health care, training of more GPs. They don't have enough GPs. They don't have enough nurses. It's the same problem we face in the UK. Next slide, please. Next slide, please. That's it. We did operations. We carried out operations. Next slide, please. Next slide, please. The WHO checklist, which is a simple tool to prevent disasters from happening in hospitals. We are going to introduce that into Namibia. Next slide, please. So we took orthopedic surgeons. They operated on a frozen shoulder. Dr. Bauer, the anesthetist, was there. Next slide, please. A fractured neck of femur. In the UK, you have to operate within 48 hours or else the outcome could be death. But we have people waiting for 4 weeks in Namibia. Next slide, please. Next slide, please. Ophthalmology. Ayman is here. There are 3 ophthalmologists in Namibia. Population of 2.5 million, you can imagine. Next slide, please. Maternal and child health. Mortality rate, that's one area they're doing very well. They're bringing down their maternal mortality rate and being able to achieve SDG goal 3. Next slide, please. We undertook teaching, training, and it shows before training, 33% of people got 60%. After the training, 80% got over 60%. It shows that education and training develops the people, the knowledge, the skills, and then performance. Next slide, please. So, all work and no play makes Rotimi grumpy. We formed friendships. We went on a safari. We visited the diamond factory. I think I ordered one for my wife. It's still on the way. She's here, so I had to put in that. And we went to a tannery. Next slide. That's the safari. They took us on to a very beautiful place. You could say the Namibian beer. Doctors drink, but to a limit. But we had a good time. Next slide, please. So that's recommendations, not for this meeting. Next slide, please. Next slide, please. I mean, Paul had a great time. Paul, can you stand up? Let's see you. Yeah. Amen. Yeah, can you stand up? Yeah. Thank you. I think those are my colleagues who are there, who are here. Like I said, Jack couldn't come. You all know the president, our chairman. So next slide, please. Next slide, please. That's what we want to do. So the 1 week visit showed so much good practice. The doctors and nurses and healthcare professionals are willing to treat patients to make them better. But they have limitations, and that is where Adam Global comes into that. People think that when you spend on health, that is wasted? No. If you don't have a workforce, healthy workforce, then how are you going to deliver? So the return on investment, when you spend about 50% of your budget, that's the recommendation for Africa, is very good. Next slide, please. So we do hope that our collaboration, our relationship, and partnership with the Namibian people will continue. There are lawyers, there are financial people here. We hope you will come on board, because at some point in time, when we get that big contract, we'll need to come and seek your advice as to how to manage it. Next slide, please. And that's just before we were leaving the hotel for the airport. Sadly, the guys in front looked after us. No, it was a very good visit, very good experience. Next slide, I think, should be. So the next step, we're going to have educational programs, virtual. We don't have to go physically. Now we've got Zoom, we've got Microsoft Teams. So there's a lot that we've planned with the government. We're still in discussions with them. Next slide, please. That's a video which will not show. Next slide, thank you. So that brings me to the end of my talk. And the theme for this conference is AI. There's no doubt that artificial intelligence has a role to play, and a significant role to play in healthcare. When you look at AI and chest x-rays, AI could read 200 chest x-rays in 5 minutes. Human beings cannot do that. It probably will take us a month to do that. So, and again, COVID showed what we could do with telemedicine. You could sit down at home and speak to your GP. You could take a picture of a skin lesion and send it to your doctor, and so you don't have to. So those hard to reach places, even in the West, not to talk of low to medium income countries, artificial intelligence has a place. So my submission to you is that we in the healthcare space, we do not want to be left out, because we believe that artificial intelligence has got a role to play in healthcare. Thank you.
Any questions?
Thank you, Dr. No questions? Just to thank you for a wonderful presentation and a wonderful outreach in Namibia. Wish you all the best.
Thank you for.
Dr. Rotimi, thank you very much for that. Hello? It's on, okay. I've got 2 questions. When was your visit to Namibia?
January
This year.
2023, yes.
And how long is the lead time for the diamonds to get here from the wire?
No, it's going to arrive on, we're getting home on Sunday, tomorrow, Monday. I just got a text.
You've got to understand the boss office.
Yeah. Thank you. Yeah.
What do you see as the limitations of artificial intelligence in healthcare? Where do you think it will start going wrong if you use it too much?
We usually say what you put in is what you get out. If you put in poor data, we've heard today that it relies on data, historical data. If we don't look in critically and be proactive, then that's where it's going to go wrong. Because medicine is not static, things keep changing, keeps changing. So we have to have a team that looks at new things coming in and then feeding it into the platform to take that into consideration in how we use AI. So you will still need human beings. Thank you. No, please don't allow. Please.
It's important that the contact with the media started networking and knowing someone too. There are 11 different professions and different countries here. Obviously it shows that from the networking or knowing people in different countries, Africa does have a need like Namibia. So I'm just talking because there could be other African countries that this could help and other emerging countries. But the African countries lag behind, not because of educational or infrastructure, things like that. So it's important that we use this network to ensure that we can reach the top and do a repeat of Namibia. That's my observation.
Thank you. She didn't introduce herself.
No.
The boss.
Yeah, the boss, yeah.
Thank you very much, Professor Jaiyesimi, for a very interesting presentation. My name is Dr. Macaulay. I practice in UK. Now, I was just looking at Namibia, which is 5 times the size of Nigeria. A country 5 times the size of Nigeria, Namibia with 2.5 million population, Nigeria about 200 million. Now, do you think artificial intelligence will work in Namibia? Because I would think that a population of 200 million is where you should put your effort to ensure AI works compared to Namibia. What is your comment?
My comment is that we have one common thing we're humans and we need healthcare. Everybody in this room will need a doctor at a point in time. Nigeria needs AI, Namibia needs AI, Spain, Italy needs AI, the UK needs AI. We all need AI. In whatever ramification in the health space, more so in the health space because of resources. And we know what has happened to flying for conferences or on missions. But with AI and telemedicine and emerging technologies, Internet of Things, machine learning, we don't have to leave our country to go and train or teach people. That's the beauty of the emerging technologies we do have, and I will encourage it. I think it's the way forward. And it's going to get better. 3D modeling, 4D modeling, all sorts of things going on. Robotic surgery. Please let me give you this example. Even before we started talking about AI, I went on to a mission to Tanzania in the mid-1990s, and using British Telecom narrow broadband width, we could connect my hospital in Newcastle with a hospital in Tanzania. So we had gone there, trained their surgeons on how to do laparoscopic surgery, but eventually what we could then do was we could stay in Newcastle, use British Telecom line, and direct them should they have problems. So the technology in healthcare is here to stay. There's no doubt about it. Thank you.